I do a lot of ultrasound research and broadly looking at how to improve the usability and diagnostic capabilities of freehand ultrasound. So historically, ultrasound, it's non-ionizing, it's fundamentally safe, but there's a lot of user variability, a lot of sonographer variability, depending on where you place it on the body, what's the exact orientation, pose, and position, how hard you're pressing. So one of the things that we will do is measure or control the acquisition state. So we use the skin of the body as a global landmark that allows us, by mounting a camera to the probe, the ultrasound probe, to figure out the orientation and pose of the ultrasound probe with respect to the body. And we can convey that information over time, so we can enable a sonographer to get back to the same place on the body by looking at the skin features and also the structures that we're seeing in the ultrasound image. So we've, from that, and then adding the ability to measure the force that's being applied or control the amount of force that's being applied, have engaged in a number of clinical studies. Actually, a pretty interesting and exciting area for me, and I just had a meeting with one of the big pharmaceutical companies yesterday, is looking at clinical trials, where if you can get better data from a patient or from a person enrolled in a clinical trial, and better data can mean that you get it in the context of their daily living in the home, and you can get it more frequently, then you can potentially reduce your enrollment population. You can potentially get better data, so it overall can lower the cost and improve your ability to get good clinical data out of a trial, out of a drug trial. So whether you're developing drugs for treating arthritis or inflammation, these are the types of things that actually, when you have ultrasound and when you can robustly measure and control how the ultrasound is being acquired. Because if you're not doing that, the variation of the measurement that you would get out of the ultrasound image is so extreme, it's hard to make sense of any numbers that you get out of the imagery. But once you add our technology of being able to measure, understand, and control the acquisition state, then suddenly ultrasound becomes a much more versatile and useful and quantitative tool. So what we're doing is actually, for the first time, have demonstrated that with ultrasound, we can extract truly quantitative measures of progression that are right now not progression on an individual. So far we've demonstrated that we can track progression in a population. So we're able to identify information in the ultrasound images that correlates to the age of the patient or the severity of the disease. And as soon as the data collection is done, we feel that we'll be able to demonstrate that with an ultrasound image now, we can get to something that's highly quantitative in tracking that progression. We're looking at liver imaging and thyroid imaging. So this is partially in collaboration with GE. And I'll use the example of thyroid imaging. The standard of care for the thyroid of monitoring and detecting or choosing to biopsy nodules is if over a 6-month period, if one of the main axes of the nodule has increased by 50%, which is a huge number. But the reason that the FDA guidelines are set as such is because there's so much variation in those two subsequent measurements. So what we're doing is using the skin tracking capabilities and then using our force measurement capabilities, getting very repeatable volumes longitudinally. And so once you have a robustly, highly controlled, accurate reconstruction of the thyroid and thyroid nodule from January and July and the subsequent January, then you can very robustly measure and compare how that nodule has grown or not grown, and really lower your error bars on the decision, or your bounds on the decision on whether or not you're going to biopsy or doing some type of intervention on the treatment of the nodule. And that, as I said, is sort of a project that's partially funded by GE Research.